Imagine this, you're lounging in your favorite armchair, scrolling aimlessly through your phone, when suddenly an unsettling itch erupts in a place you rarely think about under your arm or perhaps around your ankles. You dismiss it thinking, it's just a minor annoyance. But here's the terrifying truth: that innocent-seeming itch could be your body desperately trying to warn you of impending disaster. What if beneath that itchy surface, your blood sugar levels are surging dangerously close to diabetes, or your arteries are silently narrowing, edging you closer to a catastrophic stroke? This isn't mere paranoia, it's a chilling reality, especially as you age, when even small signals from your body can indicate major internal crises. I once treated a woman who brushed off a persistent itch on her legs and underarms for months. By the time she finally sought help, her blood sugar was dangerously out of control, and doctors were battling to save her from severe diabetic complications she never saw coming. Here's the brutal truth: your skin isn't just an outer covering, it's a mirror reflecting internal health crises lurking quietly beneath. So if you or a loved one has ever ignored persistent itching, buckle up, because today you're going to discover three critical body zones where itching isn't just a nuisance, it's an urgent distress call from within. Stay tuned as we reveal shocking real-life stories, groundbreaking medical insights, and a powerful strategy designed specifically to keep you or your loved ones from becoming the next tragic headline. Transition: a brief true or composite clinical story. A few years ago, I interviewed a gentleman, let's call him Mr. Powell, who had recently retired at the age of 63. He drove a bus for over 3 decades, day in and day out, and prided himself on never missing work. One day, after stepping out of the shower, he noticed his underarms itching relentlessly. He changed his deodorant, thinking maybe it was an allergic reaction. When it didn't subside, he tried antibacterial soap. Still no relief. Soon it got so persistent that he would scratch at the bus stop on his break, even unconsciously while talking to friends. At his annual physical routine, blood work revealed substantially elevated blood glucose levels, an unmistakable indication of type 2 diabetes. Before that test, he had no idea anything was amiss. Aside from some thirst and fatigue he attributed to the rigors of his job, the underarm itching turned out to be an early clue that something was off. This taught him, and later me as I interviewed him, that the body will often wave a red flag, but we have to be watching for it. Now let's get into precisely why these seemingly minor irritations might be the key to detecting diabetes, hypothyroidism, potential tumors, or other ominous conditions long before they turn life-threatening. Science: why itches can mean more than dry skin. Itching, known medically as pruritus, is triggered by the stimulation of specific nerve receptors in the skin. These receptors communicate with the spinal cord and brain, which register the familiar urge to scratch. Usually this is caused by minor localized irritations, mosquito bites, mild allergic reactions, or dryness, and then quickly subsides. However, pruritus can also be triggered by substances circulating in the bloodstream, such as excessive histamine from allergic responses or cytokines and chemicals released by cancerous cells. In older adults, the skin undergoes changes. It can become thinner, less oily, and more prone to dryness. Still, dryness alone doesn't usually produce unrelenting itching in unusual places. The difference is that certain pathological processes like poorly managed blood sugar or hormonal dysfunction alter how our nerve endings respond or how our skin maintains moisture. According to a 2019 report in the journal Clinical Dermatology, persistent, unexplained itching in people over 60 can be a red flag for deeper internal problems. Studies at the World Health Organization (WHO) and the Harvard T.H. Chan School of Public Health highlight that when older individuals in particular develop chronic itching in regions not commonly associated with seasonal dryness or routine skin conditions, there might be an underlying metabolic or neoplastic cancer-related cause. The body is sounding a subtle alarm, urging you to investigate. This means that the adage, "if it itches, just scratch," it doesn't always apply, especially when itching recurs or intensifies for days, weeks, or months. Reaching for an over-the-counter cream might mask the symptom temporarily, but if there's an ongoing metabolic disturbance, like thyroid malfunction or uncontrolled glucose, surface-level creams won't fix the source of the problem. When we talk about the underarms, the anal region, the genital region, or the lower legs, itching in these areas can indeed link to specific disruptions from diabetes to hypothyroidism to anal pathologies. Let's examine each region in turn, exploring real-life examples and the scientific rationale that underlines why we should pay heed. Itch zone number 1, armpits blood sugar signals. One of the more surprising itch zones tied to serious health concerns is the underarm region. On the surface, if you experience itching under your arms, you might assume it's simply from sweat bacteria or friction from clothing. Sometimes that's precisely the cause. However, if this persists and intensifies, and especially if you notice changes, like dryness, odd discoloration, or a rash that doesn't respond to typical antifungal or antibacterial agents, it could indicate that something deeper is going on with your metabolic health. Why the underarm, skin, and the axillary? Underarm region is warm and houses many sweat glands. When your blood sugar is chronically high, prediabetes or type 2 diabetes, it can disrupt normal nerve function and the skin's balance of moisture and microorganisms. Elevated sugar levels feed yeast and bacteria, leading to repeated or stubborn infections. Meanwhile, diabetes may also damage small nerve fibers, generating neuropathic itching sensations. Dr. Michael Greger, a physician recognized for his significant review of nutritional research, particularly in Nutrition Journal, circa 2015, has consistently noted that warning signs like recurring skin troubles can be the earliest way some patients detect diabetes. Stabilizing blood sugar and adopting proper skin hygiene and diet can relieve these issues in many cases. Remember Mr. Powell, the bus driver? His intense underarm itching indeed led him to discover dangerously high glucose levels, which had been wearing down his body for who knows how long. Had he not listened to that signal, the condition might have quietly progressed, damaging his kidneys or his cardiovascular system, possibly precipitating a stroke or a heart attack years down the line. The armpit region, therefore, can be an unexpected window into your insulin sensitivity or resistance. If itching under your arms continues unabated for weeks, check if you also have symptoms such as frequent urination, unusual thirst, or unexplained fatigue. If so, talk to your doctor promptly. Itch zone number 2, anal region, hemorrhoids, fissures, and worse. Next, let's tackle a more sensitive subject, anal itching. Many people are uncomfortable even mentioning anal or rectal issues, so they might suffer in silence. At first, you might suspect it's just poor hygiene or occasional hemorrhoids. Sometimes that's exactly what it is. However, anal itching can also signal deeper pathologies, including rectal polyps, anal fissures, and in severe instances, cancers in the rectal or anal canal. You might be wondering why these different conditions manifest with itching. Hemorrhoids, for instance, are inflamed veins in the rectal area. They can produce mild bleeding mucus or a constantly irritated feeling, all of which can lead to persistent itching. Anal fissures, small tears in the lining of the anal canal, also cause severe pain, burning, and subsequent itching as they struggle to heal. But the more disturbing possibility is malignancy. Rectal or anal cancer can produce discharge, odd lumps or local changes that your nerve endings register as an urge to itch. A 59-year-old accountant, identified here as Mr. Psy, ignored anal itching for nearly 2 years before noticing blood. By the time he saw a specialist, he was diagnosed with rectal cancer that had advanced more than it might have had he come in earlier. The bottom line is that while hemorrhoids and less severe conditions are common, ongoing itching back there should never be casually dismissed if it persists or intensifies. Furthermore, some individuals may develop anal fistulas, abnormal tracts between the rectum and nearby tissue that leak fluids and aggravate the skin. This fosters a constant moist environment that triggers itching. Untreated anal or rectal problems not only degrade your quality of life, imagine the embarrassment of feeling the urge to scratch in social or professional situations, but they can also spiral into more formidable conditions. The best approach is not to self-diagnose. You can attempt basic hygiene steps like gentle cleansing and the use of soothing ointments. If the problem persists, see a doctor or proctologist. Dr. Yvonne Long, who contributed to a 2020 Digestive Diseases Symposium, specifically pointed out that while anal itching is often seen as a hygiene issue, it can be far more complex, especially in older adults prone to polyp growth or vascular irregularities. H zone for 3, genital area, gynecological and urological alarms. In women, genital itching frequently ties to conditions such as vulvovaginitis, yeast infections, or general changes in vaginal pH. Men, on the other hand, may experience jock itch or various fungal infections. However, beyond the typical culprits, persistent itching in this region for older adults can mean more complex or ominous issues. One prime example is vulvar cancer, or in men, possible lesions that could become malignant. A 64-year-old nurse, Ms. Contreras, once shared that her nights were increasingly disrupted by a relentless itch in her genital region. She tried antifungal creams and changed her laundry detergent, but the problem wouldn't subside. Tests ruled out common infections. Ultimately, her gynecologist discovered precancerous cells on a biopsy of the vulvar area. She was stunned, explaining later that she believed she would have no reason to suspect cancer just from itching. But there it was, a persistent, localized itch that signaled a more complex medical issue. In other cases, the cause might be dryness and thinning of the vaginal tissues, especially after menopause. A drop in the estrogen levels can make the tissue more fragile and susceptible to micro tears or infections. This is treatable, but failing to get a proper diagnosis can mean prolonged suffering and a diminished quality of life. Dr. Harriet Fine, who has written in the British Journal of Obstetrics and Gynecology 2018, stresses that persistent itching lasting more than a couple of weeks in the genital region of women over 60 should be thoroughly investigated. It could be something as simple as an infection, but it could also signal hidden pathology in the reproductive tract. Men don't shrug off persistent itching in the groin, scrotal, or penile region. While tinea cruris, jock itch, is common, repeated bouts might indicate immune compromise or diabetes. And although rarer, men can also develop neoplastic changes in the genital skin that present initially with itching or small bumps. In short, pay attention. If the itch keeps returning or never really disappears, it's time for medical evaluation instead of guesswork. Itch zone, Durga 4, lower legs, hypothyroidism, and metabolic slowdowns. A dry, itchy patch on the shins or calves might sound routine, especially in chilly weather. But in older adults, this region can be an early indicator of hypothyroidism, a scenario in which the thyroid gland doesn't produce enough hormones. Because thyroid hormones regulate metabolic pace, insufficient levels cause the skin to lose moisture faster, leading to dryness and associated itching. The lower legs, having fewer oil glands, typically become one of the first spots to be hit by severe dryness. Add cold, dry air into the mix, and you've got a recipe for chronic irritation. Dr. Marianne Silverman, contributing to a 2017 publication in Hormone Research, explained that the skin on the shins is particularly vulnerable to dryness because of its thinner layer of subcutaneous fat and reduced sebaceous activity. If you frequently notice flaky, scaly patches in that area, especially if lotions and humidifiers hardly make a dent in the discomfort, there may be a thyroid function issue. Ms. DiCarlo, a 68-year-old retiree, began with mild itching that she assumed was a winter annoyance, but she also experienced fatigue, moderate weight gain, and sensitivity to cold. Her doctor suspected hypothyroidism, and blood tests confirmed it. Once she started hormone replacement therapy, the itching improved dramatically. Had she ignored that early sign, she might have faced a cascade of more severe symptoms: elevated cholesterol, cardiovascular stress, and even peripheral neuropathy over time. The point here is straightforward. Not all itching on the lower legs is a big deal, but when it's relentless and accompanied by other signs like hair thinning, brittle nails, weight changes, or temperature sensitivity, your thyroid might be struggling. Hypothyroidism can decrease lifespan or lower quality of life if it leads to cardiovascular complications. So identify it early and begin managing it appropriately. Simple tests like checking TSH, thyroid stimulating hormone, and T4 levels can clarify the situation quickly. A crucial fifth consideration: lymphoma lurking beneath the itch. In addition to these 4 localized itching zones, there's one overarching health concern that can produce itching anywhere on the body: lymphoma. Lymphoma is a type of cancer that begins in lymphocytes, a form of white blood cell crucial to your immune system. Some individuals with lymphoma experience an all-over itch or itching, localized to unusual spots without any accompanying rash. Malignant lymphocytes can release histamine and cytokines, prompting nerve endings to generate that relentless, scratching urge. Consider the situation of a 60-year-old teacher, Mrs. Zhang, who noticed an itch on her arms that spread to her torso over several months. It never responded to typical lotions or antihistamines. She also experienced an unintentional drop in weight, but attributed it to being more active. Tests revealed she had lymphoma, according to Dr. Celeste Abraham, who authored a 2016 paper in Cancer Epidemiology and Treatment. About 20% of lymphoma patients report itching as an early symptom. If you notice persistent itching without any visible rash, combined with other suspicious symptoms, fever, night sweats, or enlarged lymph nodes, do not brush it aside. A thorough medical workup, including a CBC complete blood count and potentially imaging tests, can confirm or rule out lymphoma. It's critical not to spiral into panic every time you feel itchy. Many itches are benign, but the key is discerning when an itch doesn't behave like a minor nuisance, when it resists standard treatments or coincides with other unusual changes. Because itching is such a nonspecific symptom, it can feel ambiguous. Nonetheless, paying attention to it can be life-saving in a fraction of cases, especially in older adults at higher risk for cancers and metabolic diseases. Action plan: what to do next. If you suspect that your itch falls into one of these critical zones, underarms, anal region, genital area, lower legs, or is generalized but unrelenting, here's your next step-by-step outline. 1. Start an itch journal or log. Document every episode, note the day and time, location, what you were doing beforehand, and any factor that might have influenced it. A stressful moment, just finished a meal, used a new skincare product, etc. This record helps you and your doctor see patterns that might indicate diabetes itching, triggered after sugar-heavy meals, or thyroid issues worse in the cold evenings or upon waking. 2. Schedule regular checkups. Older adults or individuals with a family history of diabetes, thyroid disease, or certain cancers should undergo routine screenings. Simple blood tests like checking fasting, glucose, TSH-free T4, or a complete blood count can reveal major issues. If you notice lumps, rashes, or suspicious discharge related to your itching, your physician may also request imaging or a biopsy. 3. Refine your daily habits. Implement mild cleansers instead of harsh soaps. Use fragrance-free moisturizers to safeguard your skin's natural barrier. Keep a humidifier in your room if the air is dry, particularly during colder months. In addition, carefully dry underarms, the anal region, and around the groin to prevent fungal overgrowth. And be sure to use separate towels for different body areas if you suspect any infection. 4. Nutritional and lifestyle adjustments. If the itch stems from high blood sugar, adopting a healthier diet is often an effective measure. Eat more fiber, vegetables, whole grains, lean proteins, and healthy fats while reducing refined carbohydrates and sugary beverages. For hypothyroidism, always consult your doctor about whether you need supplementation or medication and which diet supports your thyroid function. Engage in moderate exercise. 30 minutes of brisk walking a day can significantly improve circulation and metabolic regulation. Consult a specialist. If standard interventions, moisturizers, antifungals, improved hygiene fail, it's time to see a dermatologist, endocrinologist, oncologist, or proctologist, depending on the nature and location of the itch. Early diagnosis is a game changer. Whether it's catching type 2 diabetes before complications arise, spotting a cancerous lesion early, or regulating thyroid hormones sooner rather than later, vigilance can add healthy years to your life. Call to comment. Have you ever noticed this sign? Comment, "I feel it," if you relate, "I'm safe." If not, and add a question for the doctor. Your experiences will undoubtedly help others who might be sitting at home unsure whether to take their itch seriously. The more we share, the more we learn, and the less stigma there is around discussing sensitive issues like anal discomfort or itching in intimate areas. Let's normalize talking about these body signals so that no one stays silent over something that could be an early warning of something more serious. Virality Enhancer Missing Spark. The 7-Day Itch Awareness Challenge and Personal Stories. In many discussions of health, there's a missing spark to move people from passive information gathering to real action. Let's supply that spark with a 7-Day Itch Awareness Challenge. Over the next week, track your itching episodes meticulously. Note where you feel it, how severe it is, what time it happens, in any correlation to meals, stress, or specific activities. Did you just eat a plate of sugary pancakes or finish a particularly sweaty workout? Jot it down. Why is this so potent? Often invisible health issues stay hidden until you observe a pattern. Mr. Bradley, a 70-year-old retiree who participated in a similar exercise, uncovered that his underarm itching always flared a few hours after eating sugary snacks. His doctor ran tests and discovered borderline high glucose levels, prediabetes. By curbing sugar and adding a daily walk, he not only resolved his itching, but likely dodged a landslide of complications like neuropathy or kidney damage. Another participant in a separate challenge, Miss Vera, 58, documented her lower leg itchiness peaking right before bed. Further examination revealed minor hypothyroidism, which responded well to medication. The 7-day approach is effective because short-term journaling might miss a bigger pattern. A single day's notation might show only 1 or 2 episodes, but a week's worth of data can highlight trends like itch intensity spikes after a cold day, repeated episodes tied to sugary meals, or a mild but consistent itch in the anal region. You never realize what's happening daily until you wrote it down. After the week is up, share your results with a trusted friend or family member. You can even bring these notes to your physician, who will find them immeasurably helpful in suggesting possible tests or investigations. Also, feel free to share your findings in the comments section or on social media. By doing so, you create a ripple effect. Others might realize they're experiencing something similar. Your transparency could motivate them to see a doctor, leading to earlier detection of a hidden problem. Igniting collective awareness is how we transform personal vigilance into community health improvement. If you try this challenge, come back and let us know what you discovered. 24-hour rapid challenge, share and discuss. For those who want to dip their toes in the water without committing to a full week, start with a 24-hour rapid challenge. Focus intently on your body for one whole day. Each time you feel an itch, no matter how slight, write down the approximate time, its location, and any situational triggers. Were you in a stressful conversation? Had you just exercised? Do you notice dryness or tiny bumps? Could it be after a specific meal? At the end of that 24-hour period, look at your notes. You might see clear patterns that never crossed your mind. Maybe you scratched your underarms repeatedly after dinner. Could the dinner in question have been heavy in carbohydrates? Perhaps you scratched your lower legs more while you were sitting in a cold room, which might tie to dryness worsened by hypothyroidism or just poor humidity levels. If you catch anything out of the ordinary, you can then expand your tracking or immediately decide to consult a physician for tests. This mini challenge is often enough to raise awareness. Many of us go about our day mindlessly scratching without ever noticing that we do it regularly. By shining a spotlight on the habit, you transition from passive reactor to active health investigator. Share your 24-hour results with at least one friend or family member who can provide feedback or join you in the tracking. And if you post it on social media, use an inviting prompt like anyone else noticing weird itches lately. You might be surprised how many folks chime in with similar experiences. Credibility and trust expert quotes. In 2019, the World Health Organization WHO published a public health advisory emphasizing that proactive self-examination and swift attention to unusual bodily symptoms can significantly reduce the severity and progression of chronic diseases. This stance aligns perfectly with everything we're discussing here. It's not about becoming paranoid. It's about harnessing awareness to discover hidden issues before they bloom into crises. Additionally, Dr. Michael Greger, widely known for his work collating scientific evidence on chronic disease prevention, wrote in Nutrition Journal 2015 that persistent dermatological manifestations in older patients may signal systemic dysregulations far earlier than other signs manifest. In simpler terms, your skin is often a first responder, not just a superficial barrier. If it's sending you repeated distress signals, tune in. Meanwhile, the Harvard T.H. Chan School of Public Health, through a 2020 newsletter, suggested that persistent pruritus, especially in the elderly, should prompt a thorough medical assessment if it lasts beyond a couple of weeks. This is an acknowledgement that ignoring prolonged itching can allow significant pathologies like diabetes, thyroid issues, or even lymphoma to worsen undetected. Style and ethics, staccato warnings, plus scientific grounding. Stop dismissing the possibility that an itch could be your body's SOS. Far too many see itching as a mere annoyance, certain it's no more than a minor allergic reaction. But the evidence is clear: if that itching doesn't respond to standard approaches, or it lingers, flares, and returns over and over. You must wonder whether there's a deeper cause at play. We've walked through how underarm itching can hint at diabetes, how anal itching might be tied to hemorrhoids or even rectal cancer, how genital itching can warn of gynecological or urological disease, and how lower leg itching could reflect an underactive thyroid. We also introduced the broader risk that unexplained itchiness in random spots might be lymphoma. These possibilities aren't based on sensational claims. They stem from medical research, expert testimonies, and patient experiences. None of this replaces your physician's care. In fact, I implore you to maintain prescribed treatments and always consult professionals. If you're on blood pressure medication, insulin, or any course of therapy, do not quit because you suspect a new problem. Instead, share your concerns with your doctor to integrate your existing care with potential additional screenings or treatments. Conclusion: we have traversed a roadmap of subtle yet potentially dire warnings your skin can give you. By paying attention to underarm itching, you might catch high blood sugar before it spirals into more dangerous complications. By not ignoring itching in the anal region, you might detect or prevent something like rectal cancer at an early stage. By evaluating genital area itches, you could discover a hidden infection or, in rarer cases, a malignancy. And by heeding lower leg dryness and itch, you might realize your thyroid hormones need balancing. We've also underscored how overall unexplained itching could be the hallmark of lymphoma. Let's recap the 3 key points you must remember. Persisting in certain itch zones, underarms, anal, genital. Lower legs may signify lurking health conditions more serious than ordinary dryness or minor infections. Simple proactive measures like a 7-day itch awareness challenge or at least a 24-hour tracking log can reveal patterns that guide timely intervention, validated by experts. Yahoo Harvard T.H. Chan, Dr. Michael Greger, among others. Persistent itching in seniors is often a pivotal early indicator of more complex systemic issues. If you found this video and script helpful, please hit the like button. Consider subscribing and share it with friends or family members who might be dismissing their recurring itch. We need to spread the word so fewer people suffer preventable complications. Also, leave a comment to let us know, have you or a loved one ever discovered a serious health condition when investigating what seemed like an insignificant itch? Finally, here's an open question for you to chew on. What single daily habit, perhaps a dietary change, a hydration tweak, or a short exercise routine, could you adopt today to dramatically lower your risk of all these hidden itch triggers? Share your thoughts. By comparing notes, we might unveil even more strategies that could save someone's life. Stay alert, stay curious, and always remember, consult your physician whenever in doubt.